This is Heart Rhythm TV, and I am Julie Shea here with another episode of Advancing Allieds. Today's segment is part of our AP Spotlight, and with me here today I have Lisa Roelle, who is a physician assistant at the Washington University in St. Louis, Missouri. So welcome, Lisa. Thanks so much for joining me today.
Thank you, Julie. Thank you for having me.
Yeah, so Lisa's in a pediatric practice there, and can you tell me a little bit about your role? What is a physician assistant in a pediatric practice? What is that? Can you tell me a little bit about your role?
Sure, yeah. So I've been a PA for about 15 years now, and the way that we work is I work really in collaboration with our EP physicians. And so I have my own outpatient clinics, and I see my own cohort of patients. I see patients alongside the physicians, and I see a lot of the device kiddos. I do their checks during the office visits. I'm also in charge of all of the remote monitoring that we do in our clinic, and we have over 300 devices that are in our clinic. So it's a lot to do. We're busy.
That's a lot.
Yeah.
Having 300 patients to manage by yourself.
It is. It is.
Yeah.
But it's doable, you know, with the platforms that we have, and definitely makes it easier for sure. And then I also do a little bit of research. Primarily, I've been focused on digital health in pediatrics.
Oh, great.
And using wearable technologies in our kids and how applicable they are to
What types of
pediatrics.
things do you use for wearables in kids?
We've been using primarily Apple Watch and the AliveCore.
Okay.
We've been using those.
Yep.
But really, if a kid comes in and they're wearing a smartwatch and it has the capability to record biometric data, I may bring that into some of our management plan.
Yeah, excellent.
It's part of my physical exam now is what is on their body that can also be used to aid in their diagnosis and treatment.
Yeah, absolutely. So something that they're already physically used to and comfortable with, right?
Yep,
So it makes it
exactly.
so much easier when you're dealing with children.
Right.
That something is familiar to them and they're
exactly.
comfortable with.
Yeah.
So what excites you most about your job?
Well, I really like pediatrics. I worked with adults for 6 years, in the first 6 years of my career doing internal medicine. And then I switched over to pediatrics, not knowing how much I would actually love it. I just really love working with kids. Yeah. It's fun. It's a different dynamic than working with adults. Sometimes you play in the room while you're doing an exam, or having fun conversations with the patients. So I think that that's what excites me the most, is just that we have this, it's a different dynamic.
Yeah, using a teddy bear to show anatomical things instead of...
And also giving them some autonomy. Like I just saw a toddler the other day, and she did not want me to listen to her heart. But once we inspected the stethoscope, and she held the bell of the stethoscope, then she was able to move it around, and I got a complete cardiac exam on her because I involved the patient. Yeah. That's just something I didn't do with adults.
Right,
it wasn't
exactly.
necessary, but it's also a fun component to add.
Oh, that's awesome.
Yeah.
So what, in terms of, I mean, it sounds like your job is great and, great patients and great interactions with them, but do you have any pain points, any things that are challenging for you with regard to your role?
I think some of the challenge comes from time management. I mean, there's a lot to do in a small amount of time that I really have to check my schedule and figure out when I'm going to have time to do all the things, and when am I reading out remotes, and when am I seeing patients in clinic, and meeting with my physician. Like I said, it's a collaborative environment that we have. And so I meet with her several times during the week, and we go over patients that I'm going to see, patients that I have questions on, any remote transmissions. And so all of that takes time. Yeah. So time management is a big thing. I think the other thing that's unique to pediatrics is that we don't just see the patient. In an adult world, if you went to the doctor, it would just be you, maybe your spouse, but you and the physician. For pediatrics, it's the patient, it's the parent, sometimes it's the siblings. And so we're taking a whole family dynamic in a patient encounter. And we're talking to the whole family, not just the patient, about the diagnosis and the management plan. And there's several opinions that come into play. And sometimes that can be challenging. Yeah. It's just it's a different conversation, I think.
Well, yeah, because you also have to manage the parents, right? Yeah. Because you get parents who are, upset or who don't understand, and trying to not only have to take care of the child, but take care of the parent as well.
Yeah, and I think we have to be cognizant, too, is that when we enter a room, a lot of times the parents want to control the conversation, but it's also, you have to direct it back to the patient. their child is the patient. And so it's a really fluid discussion that you have to entertain everybody in the room and everybody's thoughts in the room and make them feel like they're heard.
I imagine that must be challenging, certainly at times, trying to coordinate all of those people within the care plan for the patient. So, yeah. So anything other unique things to pediatric EP that may differ a little bit from adults that you're...
Well, I think some of the diagnoses that we see, I mean, we in pediatrics diagnose things that maybe then are followed in the adult world. We also can see and treat things that don't even come up in the adults anymore.
Right.
Like we do a lot of SVT, we do a lot of WPW.
Yeah.
And if we treat it in the pediatric stage, then it's not an adult issue at all.
Right.
And then we may be fortunate enough to diagnose somebody early in life for an inheritable arrhythmia. And that's something that we can start them on a management plan and start treating before they get to adult stage.
Yeah.
There's so many diseases that start later in life, and these are where we can come in the pediatric world, and we can start taking care of them early and have improved outcomes, I think, as adults.
Yeah. I mean, you must work a lot with genetic counselors and such within your role in terms of inheritable conditions.
We do,
and
yeah.
things.
We have a specific inherited arrhythmia clinic where
Yep.
we work with a physician, EP physician, and we'll have genetic counselors and psychologists come in if needed and have discussions with the patient. So the slots are longer because they're dedicated to that in-depth discussion about management.
Yeah, and your point earlier too about the Wolff Parkinson White patients, like when I first started this and doing EP in the late 1980s, we had a bunch of Wolff patients that we were doing ablations. It's a rarity nowadays because
they're all coming to me.
They're all taken care of by you.
Well, not me, the physicians, but
Yeah.
either way,
Yeah.
we're all seeing them. Yeah.
Well, it sounds like a wonderful role. You're doing a great job. You're in the LEAP program, finishing that up this year.
Yes,
so
it's been fantastic.
Yeah.
Yeah,
so
it's really great to be involved in HRS.
Yeah.
It's definitely made me feel more part of the community, the HRS and the EP community. So it's been great.
Absolutely. Well, thank you so much for joining me today. This is Julie Shea with Heart Rhythm TV and Advancing Allies.